Well, the World Health Organization says the death of dozens of children from acute kidney injuries in the Gambia may be linked to contaminated cough and cold syrups. The WHO's announcement followed tests on several medicinal syrups manufactured by an Indian drug company. The alert covers 4 products, namely promethazine oral solution, cofexmalin baby cough syrup, Makeoff baby cough syrup, and Magrip and cold syrup. The manufacturer, Maiden Pharmaceutical, has said that they're trying to find out from the buyer what happened with syrup exported to the Gambia. According to the WHO, lab analysis confirmed unacceptable amounts of diethylene glycol and ethylene glycol, which can be toxic and can lead to acute kidney injury. It is feared the products may have been distributed elsewhere through informal markets.
WHO has today issued a medical product alert for 4 contaminated medicines identified in the Gambia that have been potentially linked with acute kidney injuries and 66 deaths among children. The 4 medicines are cough and cold syrups produced by Maiden Pharmaceuticals Limited in India. WHO is conducting further investigation with the company and regulatory authorities in India. WHO recommends all countries detect and remove these products from circulation to prevent further harm to patients.
For more on this story, we're joined by Mamoudou Lamine Choi, a journalist based in Banjul. He joins us live via Skype. Hi there, Mamoudou. What's been the reaction there to that announcement by the World Health Organization?
Thank you very much. This is a very new development, as the latest development from the World Health Organization. The reaction hasn't gone that far because it came later during the day, in the evening, when most of the newspapers and television stations, the broadcasting companies have already done their news program. So the newspaper coverage or the television coverage of that development from the World Health Organization has not yet gone viral to an extent that people might be aware and be dominating the conversation. But we've also been seeing reaction on social media, people describing it as something that is unfortunate, that is heartbreaking, and authorities also must do further investigations to ensure that those found to be liable for what has happened to be held accountable. So thus far, there hasn't been much reaction due to the fact that the coverage of the development from the World Health Organization has not yet been widely spread by the news.
Are you hearing anything from affected families regarding the course of action that they might want to take in light of what the WHO has said?
Yes, families have not yet come out to speak. We haven't heard from any victim family coming out to react to the World Health Organization's findings, because as I indicated in the beginning of this interview, you realize that the news has not yet gone viral, and you look at the access to media also in the country here. Some of those families that have been affected in the West Coast region, rural areas, before the news reaches them, we're expecting that today, and from there that will inspire or trigger any reaction from victim families. But so long as things are going on now, the newspaper coverage is trying to inform everyone about the development from World Health Organization. Nothing has been said so far from affected families.
So now the Gambia's Director of Health Services has said that similar problems have been detected in other syrups. Tell us more, and especially to speak to us about whether more people know about this information to be on the alert about these syrups.
Yes, the Director of Health Services is one of the officials of the Ministry of Health whom I have spoken to this morning, and his reaction has been, well, there have been some investigations. The Ministry of Health, in collaboration with the WHO, we also have seen the CDC, America's Center for Disease Control, who have arrived in Banjul here. So various partners of the Ministry of Health are working to ensure that at least investigations will come out as to what the possible causes are. But the key message is that the toxicology results, the toxicology analysis that have been done in Ghana, in Senegal, have turned out to indicate that there have been, the presence of toxic in these, syrups that have been identified by the WHO, which could be linked to the death of children. So this is the key message that the Ministry of Health is giving out, and they are not ruling out other possible causes. Also, they are not ruling out the fact that perhaps it might have been, caused by bacteria. It might have been caused by other factors. Apart from the fact that this is what has been obtained from the World Health Organization.
We're also hearing that the number of deaths have increased since the last time we spoke. Can you give us an update on that?
Yes, at least this acute kidney injury, which has been affecting children, the mortality rate is so high. Between 80 to 90% of children who tested positive for it have lost their life. Now we have received an official figure of 66 deaths. 66 children have so far lost their life, while others are in critical condition receiving treatment.